Hi everyone! Have you ever been curious about your skin's needs or wanted to learn more about upping your skincare game? Well, this is the show for you. Welcome to Watson's Derm Talks, a series that helps you deal with different skin conditions with the help of Filipino dermatologists. After all, no one knows Filipino skin better than Filipinos. My name is Denise Silva and I am very much excited for this episode. So I'm just asking, what to do for sensitive skin? We've invited a skin expert and dermatologist specializing in diseases of the hair, skin, nails, and cosmetic procedures to help us all out. But before that, let me just invite you to like us on Facebook, follow us on Instagram and TikTok, and subscribe to our YouTube channel for Derma-approved skincare tips. Make sure to hit that notification bell as well so you're always updated. Now, are you ready to meet our special guest for today? You may already know her from social media as a full-time dermatologist and skin expert. She graduated from St. Luke's College of Medicine Batch 2016 and finished her derma residency training at the Jose R. Reyes Memorial Medical Center last 2020. So without further ado, let us all welcome Dr. Bea Chan.
Hi Denise, hello everyone.
Before we go deep into the topic of sensitive skin though, it might be better to have a bit more background. So, what makes Filipina skin different from other skin types?
Actually, when you say Filipina skin, first word that comes to mind would be morena.
Yes.
But when we talk about skin color, we first have to define melanin. So melanin, the pigment responsible for our skin color, is actually produced by factories we call as melanocytes. Now, when melanin matures, they can now be stored into warehouses we call as melanosomes. Now, regardless of our skin color, the number of melanocytes or melanin-producing factories remains constant and the same. And that the differences in skin color would actually depend on how much melanin is produced, the size of those warehouses or melanosomes, and the degree to which they aggregate. Of course, skin color also has a strong correlation with respect to latitude and UV intensity. Wherein darker skin types, or what we call as sun-kissed skin, are more common in countries near the equator, like of course, the Philippines. The advantage in producing more melanin is that it actually makes us less likely to be at risk for skin cancer than our Caucasian counterparts.
And speaking of types, we know that there are different types of skin specifically.
Yes, so there are actually three basic skin types: oily, dry, or combination. So if your skin is oily, your whole face appears shiny and feels greasy. Other manifestations are enlarged pores and the presence of your comedones, which we commonly know as blackheads or whiteheads. If your skin appears dry, it will look dull with more prominent fine lines and wrinkles and might appear rough, tight, and a bit scaly. And then lastly, combination skin type wherein you get the best of both worlds in that your T-zone, which involves your forehead, nose, and chin, appears oily and your cheeks remain normal or dry. But I guess what most people fail to realize is that skin type can still change, especially with aging. When you move to a different country with a different climate, and of course, with the skincare actives that you will be using. So there is a difference between sensitive skin and sensitized skin. Yes, so sensitive skin can actually occur to all skin types I've mentioned a while ago. So whether dry, oily, or combination. It is a condition with genetic predisposition manifested by burning, itching, or stinging sensations. Now, sensitized skin, on the other hand, is a temporary reaction from inappropriate use or overuse of certain actives such as your chemical exfoliants. We have salicylic acid and AHAs that are used to correct uneven skin texture and control oil production, as well as retinoids such as tretinoin and retinol that have been used to treat acne and prevent wrinkle formation. Now, use of certain skincare products with fragrances and alcohol can also damage the skin barrier, leading to skin sensitivity or skin hyperreactivity.
Let's go a little bit deeper. What exactly do we mean by sensitive skin? Can you further expound?
So the main hypothesis is that unlike normal skin, patients with sensitive skin have a weakened skin barrier which cannot effectively prevent hydration or moisture from escaping. nor can it prevent harmful external substances like microbes, allergens from entering the skin. Therefore, basically, sensitive skin is more reactive, hence it also cannot tolerate harsh weather conditions like extreme heat or cold, pollution, and can actually be further exacerbated by certain triggers like hormones, lack of sleep, and stress. Now, other factors to consider are age, ethnicity, and certain skin conditions like acne and skin atopy.
Just by having the term sensitive attached to skin, I feel like that would mean so many skin concerns. But before we go deeper into that, let's play a quick game. And this is actually inspired by what you mentioned earlier. So I'll share some common symptoms and you tell us if it's sensitive or sensitized skin. Okay, game?
Game!
First one, thin skin texture with a translucent appearance.
Both.
Next, flaking, peeling, or cracking on the cheeks and forehead.
Again, both.
Okay. Last one, small rash-like bumps or breakouts, not acne breakouts.
And then, of course, it's still both.
Can you explain?
Yeah, so just to make it super clear, sensitive skin or sensitized skin actually present with the same clinical manifestations. And that the only difference is that, of course, your sensitized skin is only a temporary reaction and can be reversible.
And on that note, is it true that acne patients are more likely to develop skin sensitivity or sensitized skin?
Yes, so most patients with acne use topical medications that are really strong. So we have your retinoids, benzoyl peroxide, salicylic acid, AHAs. Now, the problem is that some overuse these actives in the hopes of treating their acne faster. This would then actually lead to a break in their skin barrier, leading to skin sensitivity. Now, for those who already have sensitive skin, there are 4 things to keep in mind. So first, you should choose a pH-balanced, gentle cleanser to keep the skin at its healthiest state. Next, look for moisturizers specifically with anti-inflammatory ingredients like niacinamide, centella to soothe sensitive skin, and ingredients such as ceramides, squalane to strengthen the skin barrier. And then lastly, instead of using your retinoids, you can use azelaic acid. Did you know that azelaic acid has both antibacterial and comedolytic properties, and it can also lighten your post-inflammatory hyperpigmentation? Keep your skincare routine as simple as possible. Focus on 4 key steps, which is to cleanse, treat, moisturize, and to protect.
Speaking of skincare routines, I know that those can get really specific, especially for people with skin conditions, like skin asthma, which I've had as a child actually. Is it true that those who have it can also develop sensitive skin?
Just like in acne patients, patients with atopic dermatitis or skin asthma are also more likely to develop sensitive skin. Atopic dermatitis or skin asthma has genetic filaggrin mutation, which then leads to impaired skin barrier formation. This then allows increased entry of allergens and harsh environmental triggers, resulting in increased inflammation. Now, common triggers to watch out for would be soaps or detergents, molds, pollen, skin infections, and even extremes of temperatures.
Aside from treating specific skin concerns, what are some general tips on managing sensitive skin?
Topical steroids can be used to manage acute symptoms of burning or itching. But in the long run, proper skin hydration is still key to treatment success of sensitive skin. It is also very essential to identify and avoid triggers, use moisturizers on a daily basis to help maintain and strengthen skin barrier, go for powder over cream cosmetics as they are more stable and less likely to be contaminated, as well as to avoid alcohol or fragrances in skincare products, and lastly, to maintain a healthy diet and lifestyle. So for those with sensitized skin, you have 2 main goals, which is 1, to repair and strengthen damaged skin barrier, and 2, to replenish and restore hydration. You can always look for ingredients like niacinamide and ceramides to strengthen and protect skin barrier against harsh environmental stressors. Also, hydrating ingredients like glycerin, hyaluronic acid to help relieve dryness, and panthenol centella to soothe redness and restore dry skin. You must use products that are labeled as fragrance-free versus unscented, which only contains chemicals that neutralize or hide odors. And then last tip, Avoid products with alcohol, harsh astringents, and exfoliants.
Sa food naman, are there specific kinds of food that we need to avoid, especially if we have skin conditions?
Not really, unless you have been diagnosed with rosacea, wherein in general, you are advised to avoid hot, spicy foods. And it is not exactly true that you have to avoid chicken or malansang food when you have skin asthma or skin sensitivity. So guys, always remember that consistency and patience are keys to the treatment success of any skin condition. And cliche as it might sound, each skin type is really unique, and whatever skincare product or regimen that works for you might simply not work for a friend or a sibling. Hiyangan nga. And so when in doubt, you can always consult with a board-certified dermatologist.
Alright, now that we know what to avoid, what exactly do we need to look for when we're shopping for skincare products?
Yes, so are you familiar with the label dermatologically tested or certified?
I've heard of that, and it makes me feel more comfortable buying those products.
So actually, the formal definition of dermatologically tested products simply means that the finished product has been tested on human skin and that the formula is safe, well-tolerated, and is unlikely to cause a skin reaction. Next, we have hypoallergenic formulas. Actually, hypoallergenic products are indeed relatively less likely to cause allergic reactions compared to other products. But up to this date, there is still no regulation governing the use of this claim, hence it is still best to consult with a board-certified dermatologist for proper advice and guidance. Next, we have clinically proven or tested on sensitive skin for safety. So this simply means that consumers have tried the brand and experienced desired results. To put it simply, clinically proven will be equals to consumer tested. And then lastly, we have suitable for continuous use, or the more correct term would be long-term use, which is normally intended for continuous use for more than 30 days. This is the FDA-approved term and is found on FDA-approved product labels, versus your transient use, which is normally intended for continuous use for less than 60 minutes.
Ooh, thank you for explaining all of those, Doc, because we see those a lot in different products, but we don't know what it means exactly. Well, that's about it for our Q&A today. Thank you so much, Doc, for breaking everything down for us. I learned so much that I might just change my entire skincare routine altogether.
I love that. Thanks, Denise. Thanks, everyone.
Caring for sensitive skin doesn't have to be super stressful. Watsons has a wide range of skincare products that'll help. Derm Plus by Watsons Anti-Acne Purifying Facial Gel gently cleanses and hydrates skin and is great for acne-prone skin. Aveeno Skin Relief Body Lotion gives long-lasting protection against skin dehydration. Physiogel Daily Moisture Therapy Dermal Cleanser is formulated to prevent irritating dry skin. Equiva Moisturizing Facial Mist helps reduce oiliness while increasing skin hydration. Cetaphil Daily Exfoliating Cleanser removes excess dirt and oil on skin. For the sporty types, Raw Skin Repair Dry Skin Lotion leaves your skin smooth and supple. Aven Cleanse Matte Mattifying Toner regulates hyperproduction of sebum while hydrating and soothing skin. Neutrogena Hydro Boost Hyaluronic Acid Water Gel helps moisturize while preventing drying and inflammation. You may get them through the Watsons app or the 1,000 plus stores nationwide. Don't forget to like us on Facebook, follow us on Instagram and TikTok, and subscribe to our YouTube channel. This has been Denise Silva for Derm Talks, wishing you all a great skin day.